Assalamualaikum. My name is Shazana Nabila. I'm from Bachelor of Physiotherapy, Cohort 20. Today, I would like to present an evidence-based study of physiotherapy management on hemophilia. First, we will look at presentation outline. There will be some introduction of hemophilia, which cover the epidemiology, clinical features, and medical and surgical management. And then the physiotherapy management on hemophilia, and a bit of conclusion. Hemophilia is a group of inherited blood disorder in which there is lifelong defect in the clotting mechanism due to reduced levels of clotting factor, which is factor 8 and factor 9. The epidemiology of hemophilia in Malaysia, it is inherited as X-linked recessive traits, as you see in the image stated. Male are more affected compared to women. Females are carrier but can be affected as well. In 30% of cases, no family history obtainable. This is due to spontaneous male mutation. Next, the mean prevalence of hemophilia A in Malaysia has increased from 5.6 per 100,000 males in 1998 to 6.6 per 100,000 males in 2006, as you see in the chart, with a mean of 5.9, 0.4 per 100,000 males, and for hemophilia B, 1.00 plus minus 0.11 per 100,000 males. The prevalence for the high-income countries was 2.69 per 100,000 males, whereas the prevalence for the rest of the world was 1.2 or plus minus 1.33 per 100,000 males. The clinical features of this condition is present symptoms of easy bruising in early childhood, spontaneous bleeding, particularly soft tissues, muscles, joints, commonly especially hinge joints, which is the elbow, knee, ankle, and gums, excessive bleeding following trauma or surgery. Newborn or infant may present with spontaneous intracranial bleed, which is very dangerous. Child may present with post-vaccination or vitamin K injection hematoma. Next, types of bleeding in hemophilia. The serious kind is hemarthrosis, which is the bleeding on the joint. Muscles such as ellipsoid, calf, and forearm will present with such as like back pain, abdominal pain, thigh tingling or numbness, decrease in range of motion. Mucous membranes in the mouth, gums, nose, and genitourinary tract. The bleeding that life-threatening to patient is intracranial or head, which is have a sign of nausea, vomiting, headache, drowsiness, loss of consciousness, neck or throat, pain, swelling, difficulty of breathing or swallowing, gastrointestinal or abdominal, pain, tenderness, swelling, blood in the stool. As you can see here, the relationship of bleeding severity to clotting factor level in hemophilia, it is considered severe when there is less than 1% of normal clotting factor level, which is have a bleeding manifestation of spontaneous bleeding into joints or muscles, dominantly in absence of identifiable hemostatic challenge. Next, moderate 1 to 5% of normal. Occasional spontaneous bleeding, prolonged bleeding with minor trauma or surgery. Mild means 5% to less than 40% of normal. Means severe bleeding with major trauma or surgery only. Spontaneous bleeding is very rare. Next, the medical and surgical management. The pharmacological treatment, including factor replacement therapy, adjunct therapies, which is desmopressin and tranexamic acid. Analgesia for the pain. You can use paracetamol, cyclooxygenase 2 inhibitors, and morphine based on the pain level. Non-pharmacological treatment include musculoskeletal rehabilitation, PRICE, which is protection, rest, ice, compression, and elevation, joint protection, sports or physical activity, gradual post-operative care, body weight management, which may contribute to injury, Next, the surgical treatment. Commonly joint replacement surgery due to 80% bleeding episodes are in joints. Multidisciplinary includes hematologists, orthopedic surgeons, physiotherapists, hemophilia, nurse, and dentists. Next, the physiotherapy management on hemophilia mostly covered exercise, cryotherapy, functional activities or capabilities, and education on self-management. Exercise training is recommended for people with hemophilia as prevention of any injury that may cause bleeding and as rehabilitation to avoid reoccurrence of bleeding episodes. A study by J. Kaletayud et al. Regarding the safety and effectiveness of progressive moderate to vigorous intensity elastic resistant training on physical function and pain in patients was made and has shown improvement in strength and greater overall pain reduction. It is safe and effective for people with hemophilia to involve in physical activities. The study conducted progressive strength training as intervention for 8 weeks with elastic resistance. Next, a systemic review to determine the most effective physiotherapy procedures for treating the hemophilic arthropathy of ankle was done by Ruben Cuesta Barroso et al. In 2013. They included the hydrotherapy treatments, strengthening training and balance training, sports therapy, improve the ROM, pain, balance, and subjective physical performance. As you can see here, you can use a dumbbell and do some exercise on balance. Next, cryotherapy. Cryotherapy is one of the therapeutic effect is vasoconstriction, which might be helpful in reducing amount of blood flow during bleeding episodes. An article regarding local cryotherapy on acute hemophilic hematosis by E. Carlos Rodriguez Marchan and Hortensia de la Corte Rodriguez on 2017 concluded that some authors reported that local cryotherapy attenuates, which is reduce the joint inflammation and has positive influence on controlling articular swelling and temperature. But others also stated it is associated with impairment of coagulation, enzyme activity, and platelet function. So there might be bias in this type of treatment. Another study made about cryotherapy, an experimental study by Subin Chunga, to find the effect of cryokinetics in quadricep muscle of hemophilic patients in improving their proprioception on knee joint, shown there is a significant improvement in the proprioception of the knee joint by giving multi-angle isometric exercises in close kinematic chain pattern with cryotherapy. It may not be as effective for bleeding episode in hemophilic patient. However, may be effective on treatment for certain affected site of bleeding, for example, hemorrhagitis. Next, for functional activities or capabilities. Children with hemophilia has risk of reduced bone mineral density, which is BMD, muscle strength, and functional ability as a result of reduced leisure time activity and less involvement in intense activities. This is due to fear of injury due to past events. A study by Muhammad et al. 2014 shown there is significant improvement in BMD, knee extensors and flexor strength and functional ability when resistant and aerobic programs is included in intervention. The outcome measurement used to measure the functional activities is 6-minute walking test. Such of the exercises are walking, jogging, cycling, and aerobic exercises like aerodance and all. Next, the education on self-management. We as physiotherapists, one of the most important role is patient education, either on self-pain relief, self-management, and home exercises. A study to assess the efficacy of an educational physiotherapy home exercise intervention on physical improvement, pain perception, quality of life, and illness behavior in patients with hemophilic arthropathy by Ruben Cuesta Barroso et al. concluded that it can improve the perception of pain. However, there is no significant improvement in the joint status. In the study stated, the intervention that we use is a postural advice, isometric exercises, walking exercises, and muscle stretching of tricep, bicep, quadricep, and hamstring. So the conclusion of this study, it has proven that most physiotherapy approach for this condition is strength training, aerobic exercises, and cryotherapy to prevent the overcome post-bleeding episodes. Physiotherapy role may seem minimal in hemophilia management. However, it is important in order to promote and motivate patients to have the ability to live a normal life by involving in physical activities and sport. That is all for me. Thank you.